40% of children living with HIV and AIDS are unaware of their status in West and Central Africa, while mother-to-child transmission remains high, reaching 64% in these two regions. This revelation came to light at the opening of a three-day regional HIV and AIDS summit in Accra by the executive director of the Civil Society Institute for Health in West and Central Africa, Ngwisali Turpin. Now, the primary objective of this conference is to devise effective strategies to significantly reduce these figures, aligning with the 2030 UN HIV goals. Carlos Caloni has the rest of the story.
Representatives from government and civil society organizations across 20 African countries, along with donor organizations such as World Health Organization and the USAID, have convened at the three-day regional summit addressing the end of AIDS in children in West and Central Africa. Speaking to Joy News on the sidelines, the director of the Civil Society Institute for Health in West and Central Africa, Ngwisali Turpin, emphasized the summit's crucial role in crafting viable solutions to empower CSOs in the sector.
Unfortunately, we only have 60% of children living with HIV that actually know their status. We also see that, unfortunately, we have a rate of around 65% new HIV infections that were acquired that were transmitted to children because their mothers did not receive the adequate ARV treatment that is in existence. So what we are really trying to put the focus on is that community organizations, civil society organizations need to be empowered. They need to be given the means to do testing, to do outreach, and also to contribute in terms of care and support.
Underlining the necessity for stronger collaboration between state and non-state actors, Program Manager for the National AIDS Control Program, Dr. Stephen A.C. Addo, highlighted key interventions by the Ghana Health Service in combating HIV in Ghana.
Based on all the analysis, we've realized that if we have to end the epidemic, the public sector alone, the private sector alone cannot. We need to work closely with the civil society organizations. And already we have started that discussion. Next year, the Global Fund to Fight AIDS, TB, and Malaria has provided resources to strengthen further this partnership and collaboration with non-state actors. The Ghana Health Service is going to work very closely with civil society organizations to implement community initiatives in the cascade of care from testing, treatment, retention, and viral suppression.
On his part, President of the Ghana HIV/AIDS Network, Ernest Otsen, underscored that funding remains a significant challenge for CSOs in Ghana. He stressed the importance of allocating resources to combat the disease, considering the country's high HIV prevalence.
If you look at our statistics, we have about 354,000 persons living with HIV in this country. About 8% of them are children. So that is quite high a number, and that is why we need the support of government in addressing pediatric HIV. This is something that we can achieve. So all we need is for government to provide domestic resources to address this issue of pediatric HIV.
Otsen also expressed commitment of CSOs in Ghana to work towards making Ghana the first country in the region to achieve the 2030 goals on the disease.
What we are committed to doing as a civil society group working with the government is to make sure that Ghana will become the first country south of the Sahara to eliminate mother-to-child transmission of HIV and AIDS. We also want to be the first country to, by 2030, eliminate HIV and AIDS as a public health concern.
The Member of Parliament for Dafiama Bisi Isa constituency and member of the Parliamentary Select Committee on Health, Sebastian Sandari, emphasized the legislature's role in ensuring that allocated resources for the fight are effectively utilized.
What we can do as legislature, as members of parliament, is to ensure that there are enough budgetary allocations for HIV care, is to ensure that we play our oversight role, to ensure that whatever funds that are dedicated for HIV care are well utilized.
At the end of the 3-day summit, an actionable solution is anticipated to be unveiled, further strengthening collaboration between government and CSOs to achieve the 2030 goals. Carlos Galoni, Joy News.